And I have this saying, change a smile, change a life. And I've seen that so many times where we will provide a beautiful new smile for a patient. And that could be as little as whitening, yellow teeth to white teeth, or someone with malpositioned or crooked teeth and straighten them, whether it be Invisalign or with instant orthodontics with veneers, or just closing spaces or fixing chips. And they look in the mirror for the first time and tears roll down their eyes, and I'm thinking, I hope it's tears of joy, and then they give me a big hug, and it's just so rewarding. I love that, right? Our mouth is our front door to all of our health. And if you're not taking care of your mouth, you're not taking care of your body. So I would stress to every patient is go to the dentist regularly. And I'm not here to say, get your teeth whitened or get veneers, or just be healthy, because they're gonna find things, and the dental hygienist will find things that your physician may not find.
We utilize lasers, and just like everywhere in society, lasers have changed the way we're doing things now. And lasers at the Hornbrook Center for Dentistry are doing some really very cool things, whether it be in cosmetics, or whether it be in gum treatments, periodontal therapy, or even we can treat teeth utilizing lasers, where sometimes we don't even have to use anesthetic. We use the diode laser. The diode laser, it's actually a diode inside, and it cuts by initiating a laser energy that causes a little bit of heat, so we can make very clean cuts like a scalpel, yet there's no bleeding and there's no post-operative pain. So we utilize the diode if we're doing a smile design and we want to change the contour of the tissue. Let's say you have a gummy smile, or one tooth hangs down a little bit more, we don't have symmetry. We can incorporate the diode into that smile design so we can get our symmetry. And again, the nice thing about it is there's no post-operative pain, no bleeding, and there's really no downtime at all, which is really cool. We utilize this daily. The diode is also used by our hygienist. Studies have found that it kills and reduces bacteria between the tooth and the gum. So when she utilizes this in her professional cleanings, she eliminates the bacteria, promotes healing, eliminates discomfort, and really makes the whole experience so much better. The other technology that we're excited about, and we've been using this now for almost 20 years and got to the point where we have one in every single room because we're so excited about it. This is called the wand, and it's actually a computer-controlled anesthetic delivery device. Now that's a long sentence, but basically it delivers anesthetic like lidocaine or septicaine, what they used to call novocaine, at a very, very slow speed. So instead of having a syringe like the typical needle, it uses a handpiece with a really tiny needle. And we can give anesthetic, or the patients don't feel it at all. The other nice thing about this is we use much less anesthetic. Typically, if you've had a filling or something, or a crown done on the bottom, your whole side of your face is numb and your tongue is numb for several hours. That's how we used to do it. Now we can numb individual teeth. So literally, I could do a crown or a filling on a tooth on the bottom, and instead of the whole half of the jaw being numb in the tongue, it's just that single tooth. Less anesthetic, less downtime, more comfort for our patient. Again, that's important to us.
For almost 2 years now, a little over a year and a half, I've had the fortunate opportunity to have an amazing partner in my practice, Dr. Souza. And so she came to me and while she was preparing for the national boards and applying to dental schools, and said, I've heard you're the cosmetic guy and the guy that's leading the trends in dentistry. Do you mind if I shadow you while I'm getting ready to go to school? And I said, absolutely. A year and a half ago, I was looking for a partner in my practice as we got busier, and I needed someone to just continue my legacy in my care. And I called her up and she said, I'm there. And she's been great. She's a great dentist. My staff, my entire team absolutely loves her.
So I must have had a really good dentist when I was a kid, because I've been always fascinated about dentistry.
My favorite part about being a dentist is helping people achieve better quality of life through their smile and through their oral health.
I think dentistry is moving a lot towards relating the dental conditions of the people, something that is linked to the entire health. And I think dentistry and medicine are going to start working together more.
We have an amazing staff. Everybody's very friendly, is very knowledgeable, and we treat our patients very warmly. Everybody that walks into the door is treated with a lot of care. We listen to our patients, we care about their outcomes, the outcomes of the treatment. We are worried about answering all their questions. So I think this is amazing because it makes me feel that I'm providing the best for my patients when I have all my team in the same pace. We use the state-of-the-art equipment and materials to best help our patients in our treatments. So we always in tune with what is the most advanced technology out there, and we use that technology in order to help our patients and provide beautiful results.
For as long as I can, as long as I'm healthy, and if I'm 100 and I'm still doing this, I'll be happy.